Welcome, everyone. Thanks very much for joining us today so that we can share this important piece of work that Penrith Council has been able to do. My name's Melissa McSeveny. I'm the Social Strategy Coordinator at Penrith City Council. And I'd first like to acknowledge country. So Penrith Council values the unique status of Aboriginal people as the original owners and custodians of lands and waters, including the lands and waters of Penrith City. Today, I'm not in Penrith. I'm working from this beautiful Darug and Gunungurra land. And I especially want to welcome any Aboriginal and Torres Strait Islander people who are here today and pay my respects to elders past, present and emerging. I'd like to thank Western Sydney Community Forum for partnering with us on this webinar and helping us to launch this report. We have Charlton working hard in the background to making sure it flows smoothly. Thank you, Charlton. I'd also really like to thank Alyssa Guttridge in the social strategy team for undertaking the bulk of this work. It's been a real challenge for all of us to know exactly what's happening for people on the ground, how the impacts of COVID were changing for people as the restrictions changed. And this work has been able to provide council and others in the Penrith area with the information that we need to plan strategically around how we respond to those impacts and support our communities and businesses. Thanks, Alyssa. I'd also like to thank all the people who've collaborated with Alyssa in supporting this work across the teams in council. The information in this report that we're presenting today is based some on publicly available data, but largely as well on surveys that we've undertaken locally with residents, businesses and community service organisations. The first survey that we undertook across those sectors was in August, and I just wanted to flag we've just undertaken another survey this week with residents, and we'll be going through that data over coming days, and we'll publish an update to this report when we've done some analysis. So keep your eye out for that. I'd like to now hand over to our Mayor, Councillor Karen McEwen, OAM, to give a pre-recorded official welcome to everyone. Thank you.
Thank you for joining us today as we share this important report into the social and economic impacts of COVID-19 on our community. Just like many organisations across the city, thank you for joining. Penrith Council has worked hard to support our community and businesses through the pandemic. We've taken a wide range of measures from fee and commercial rent relief through to our Good Neighbour cards and the recent partnership in establishing the North St Mary's Hamper Hub. We will continue to respond to emerging challenges in this fast-changing environment. And to do that, it's vital we stay connected to our businesses, community support services and residents. Last month, we surveyed a diverse range of residents, business owners and community sector workers to get a better idea and understanding of the challenges they've been facing. I'd like to thank everyone who took part. You've provided important information to give us a good overview of how the pandemic is impacting on our city and what we can do to address that impact. We've collated that information into this report, which is now available on Council's website. We'll also be conducting further surveys and research in the coming months to create a more comprehensive report showing the changes in issues over time. Both this and any future reports will help us make more informed decisions and support other organisations in our city with information to plan their services. What we heard and what the report tells us is that engaging with residents has been challenging for our service providers. Our business owners have talked about the difficulties related to supporting themselves and their employees through the impacts of decreased demand. Our residents are worried about the people they love and their own financial and job security. Concerns about mental health have come up in all of our surveys. But we also asked what has been a positive effect on people's well-being through the pandemic. People are feeling supported by their friends, family, neighbours, and are also buoyed by helping others. People are also getting out to exercise and are getting quite creative. Having this finger on the pulse of our community will help us be more effective conduit for information and to coordinate practical support to overcome challenges and to build on the existing strengths of the community. As I'm sure you all appreciate, the future is hard to predict. We've all seen how quickly the COVID situation can shift and change, and the easing of restrictions is bringing both relief, but it will also exacerbate other issues. We also recognise the income support changes will affect vulnerable people. But if we keep the lines of communication open, we can shift and change too, and continue to support our community in the best way we can. Thanks again for being part of today's webinar. While this report takes an in-depth look at the challenges we're facing, it also provides learnings and highlights some successful local projects as examples of ways we can continue to support everyone in moving forward.
Thank you, Madam Mayor, for that welcome. I'll now hand over to Tom Nance, Manager Policy and Programs at Western Sydney Community Forum, for another welcome from them. Thanks, Tom.
Thanks, Melissa. And I too want to acknowledge the traditional custodians of the land I'm on today. I'm on the lands of the Capricorn clan of the Darug Nation and want to extend my respects to elders past, present, and the emerging leaders in the Aboriginal and Torres Strait Islander community, as well as any Aboriginal and Torres Strait Islander friends joining us today. So firstly, thank you, Madam Mayor, for the introduction, and congratulations to both Council and its team on this critical research. Of course, there's been social and economic impacts in terms of COVID-19 on the communities of Penrith, on the businesses of Penrith, and anyone who works, lives and plays in Penrith. I'm pleased that Council's been so proactive during the latest outbreak. We've heard from the Mayor, initiatives like the Good Neighbour cards and hamper hubs have been rolled out to support the community. But just as importantly, Council has been proactive in connecting with its communities and capturing data in a way that underpins strategic decision-making as we move out of this lockdown. There's commonalities we've seen in this wonderful report with other locations and areas of concern across Greater Western Sydney. The concern of businesses who are needing to adapt to survive, as well as the digital divide that's become a yawning chasm during this pandemic. There's also the concerns of residents around access to public, open and shared spaces, as well as social isolation and loneliness. Not only does this report highlight these issues, it also adds nuance to these challenges that are faced by residents of Penrith, and the report unpacks that. I congratulate Council because not only have they looked at what some of the issues are that the pandemic has caused, but also they're focused on some of the resilience factors that we see within the community around community connection, around connection to place and to family as well. Of course, the road to the pandemic is a winding one, and likewise, the road out of the pandemic is winding too. And as you'll hear from our panelists today, it's full of challenges, particularly for those in the community who are most vulnerable. This piece that Penrith have put together, the social and economic impacts of COVID-19 report, contains critical insights for the community sector, for government, for business and for the community to create solutions as we emerge from the pandemic, both independently but also in collaboration. Thanks very much, Melissa and the team, for collaborating with us to launch this. We're really proud to be doing that with you and supporting this initiative. And I hope all of you in the audience enjoy the show. Back to you, Melissa.
Thanks, Tom, and thanks again for the support from Western Sydney Community Forum. It is a piece of work that we're quite proud of because we know that it will be not only interesting to people to find out about some of the information in this report, but really useful to support people in supporting the community moving forward. Just an overview for everyone on how today will work. Please note that it's being recorded, although we can only see my video as host and the videos of the panel members as they come up. I'll take some people through some of the key information from the report in a presentation in a moment, and then we have a panel of local experts to discuss the issues and challenges for the local communities, and I'll introduce that panel after the presentation. When the panel is available, there's also an opportunity for the audience to ask questions using the chat function. So we'll move to the presentation, which I will try to move through quickly. There's a lot of information in this report that we've produced, and I'd just like to give a taste of that today, and an opportunity for these local experts to discuss the issues that were raised. And we'll also provide the location for the report for people to look at for themselves. Thanks, Charlton. As I said, this project was led by Alyssa Guttridge in the social strategy team, and I just want to thank you again for this important work and for everybody who's collaborated in getting this report together. I think everybody should be proud of this really useful piece of work. This slide's talking about the purpose of the document. We know that through the pandemic, restrictions have changed frequently and rapidly, and with those restrictions changing, the impacts change as well for different businesses and residents and organisations. To support the community and businesses, we need to know what's impacting them and how it's impacting them. So I know we've all had anecdotal information and heard pieces of the story here and there, but it was really important for us to undertake these surveys with the community sector, the businesses and the residents to get that bigger picture and find out what the challenges are, the trends in those challenges, the patterns with the impacts, and more importantly, where the opportunities are for us to support. On this next slide, we've got a summary of the key challenges that were coming up for people and organisations. We undertook a survey with 162 residents, which is a statistically significant number of people in the Penrith population. 59 community organisations responded and 44 businesses, although they were mostly small businesses. And we can see here these lists of key challenges that came up in those surveys. We know the impacts were varied. They affected some more than others, but when you're looking across those three columns there with the three sectors, or the three surveys that we did, you can see some commonalities. People were worried about those important to us: parents, children, friends, neighbours. People were feeling lonely and isolated. If you're a business owner, you're worried about the viability of your business and the well-being of your staff. So again, mental health coming up there. And community services were finding it hard to engage with and support people. It was a challenge for them to know what their clients needed. On the next slide, we've got some key learnings from those surveys, looking at the challenges that were coming up, the things that we've learnt in working with businesses, the community sector and the residents, and the things that we consider moving forward. We know businesses have learnt about adaptability and agility, quickly changing their models to respond to restrictions as the restrictions changed. And going into the future, we know that it's vital for communities to be able to support their local businesses. As Tom mentioned before, digital access and inclusion, it's been a complicated challenge for the community sector to respond to. And moving forward, we really need to consider the best ways for equal access to digital information. Tom also spoke about that access to open space and that importance to residents. In Penrith, we're lucky to have a lot of good quality green space that's available for the public, and into the future we need to focus on how we'll strategically plan to protect that green space and ensure we have enough for the future population as well. In terms of social isolation for residents, we know that the best way to address that is prevention and ensuring that there's community resilience and community connection before there are disasters and pandemics. And that will definitely be a focus into the future for everyone. On the next slide, we've shown how this year's lockdown compared to last year's. I'm sure everybody felt the differences between this year's and last year's lockdown, and this shows in what ways it was different. The government financial support was different each time. It was for longer this year, and that ongoing lockdown compounded challenges for households and for the community services trying to support them. On the next slide, we talk about the impact on employment. There's a bit of a lag with data, employment data that's publicly available, especially by local government area. And we really needed to know how the lockdown was impacting people within a matter of weeks of the lockdown. We couldn't wait months for that publicly available data. On the left here, we've got a pie chart showing people's current work status. So 44% full-time, 21% part-time, etc. And then on the right there, we have a column graph showing how those working conditions changed with the pandemic and the lockdown. So you can see that over 50% of individuals were affected by reduced hours or work opportunities during the lockdown, which is significant. On the next slide, we talk about Jobseeker and Youth Allowance. You can see here that in March 2020, Penrith was pretty similar to Greater Sydney in terms of the proportion of people on these Jobseeker and Youth Allowance. And then once lockdown had kicked in early 2020, Penrith increased slightly quicker than the rest of Greater Sydney, but then it follows the same pattern from there on. The reasons for the increase in Penrith compared to Greater Sydney could be because of our younger population, or it could be because of the types of jobs that people have in Penrith compared to Greater Sydney and how they were impacted differently. We know that the suburb of Penrith and the suburbs of St Mary's and North St Mary's had the highest rates of people receiving those benefits. We then go to look at local businesses. This shows a bit more in-depth information about the challenges and impacts for our local businesses. In the August survey with these businesses, 33% of business owners anticipated that these impacts would remain for another 6 to 12 months, and another 38% thought they'd continue to be impacted for longer than 12 months, which is quite concerning, and time will tell, but it gives you an idea of what these business owners are facing during lockdown. We then look at a more in-depth analysis of what we heard of the community sector. So from the 59 respondents in the community and cultural sector, with some cultural groups also being surveyed, we heard about the challenges for their clients, challenges for their organisations, and also what they thought would be needed over the coming months. And it was interesting to see that the challenges they identified for their clients really closely aligned with what we were hearing from residents more broadly too. They talked about financial pressures, feeling lonely, and the stress from homeschooling and access to technology and loss of income in people's households. To respond to those challenges over coming months, a lot of organisations thought it would be important to firstly support their own staff to be engaged and well. You can see there that top priority with anticipated needs in organisations is supporting staff engagement and staff mental health. And obviously that is something that's needed before those staff go out and work with community and be able to support community well too. The next slide is a word cloud. When we surveyed the community sector around priorities over coming months, you can see some of the words that were responded to there. Again, mental health is coming through as a major concern, as well as financial concerns and food for their clients. When we asked about support for community organisations on the next slide, we can see that community organisations found it really helpful to be getting updates. You can see COVID updates from government. So that information that they were receiving was really helping them and inform their work. You can also see a lot of words there around staff and teams and caring for each other to support each other in the organisations. On the next slide, we go into what we heard from residents. So again, it was 161 residents that we surveyed. And you can see here how common it was for people to be worrying about others, not being able to do the things that were important to them and feeling lonely. Those issues were coming up again and again. People were heavily affected by not being able to see family and friends and not being able to travel or go to events. I have to admit, when I first saw that that impact around events and travel plans, I questioned, whether how that could impact people so majorly, but then remembered people often are traveling to see family and friends, and that's also about social connection and being able to escape the situation that they're in. And again, events are around that social connection and recreation that people weren't able to participate in. And as the Mayor touched on in that welcome, one of the most important parts of our survey was finding out what's having a positive effect on people, and finding out where the opportunities are for us to support people and build on what's working for them already. It was great to see that people were positively impacted with support from others, and also being buoyed by helping others themselves. People found it positive to get outdoors and exercise and be creative. And as you can see at the time of this survey, which was in August as the vaccinations were just rolling out, there was a high proportion of people who said that being able to be vaccinated had a really positive impact for them. The next slide here shows exactly all the issues that were impacting people in the order of the proportion of respondents those issues impacted. So you can have a look through those issues yourself, but if we're to group some of those issues by themes, we can see that 93% of people were impacted by feeling isolated and not being able to do activities as usual. 93%, that's significant. 64% talked about physical and mental health issues, and 56% talked about the stress of working from home, which we know is exacerbated by children being at home as well. And when we delve into these results further, which you'll see in the report that's available online, we know that females were more likely to be impacted by feelings of isolation and the stress from children being at home. And then when we look at the residents who spoke languages other than English, almost a third reported not having daily essentials available, like food and medicine. And these are some of the things that can inform our work and services going forward. The next slide talks about quality of life for our residents. When we asked our residents about their quality of life and what was having a negative impact, limited contact with friends and family ranked the highest across all the age groups and cohorts. Interestingly, it was the 35 to 49 year age bracket that were most affected by things like loss of income and employment, school and childcare interruptions, and not being able to get vaccinated. It will be interesting to see in our next lot of data from the survey we've conducted this week, what's changed around people's feelings with being able to be vaccinated. Now we know the vast majority of people have been vaccinated. The next slide looks at positive impact on quality of life. So we can see here what's been positively impacting people and helping them through. In there, you can see the support from others, providing help to others, getting out to exercise, getting creative. For people over 50 years of age, we know that getting vaccinated was what had the biggest positive impact for them. And when we delved deeper to find out whether people were able to rely on others for support, almost 90% had someone they could call on for advice or emotional support, which was great. We saw that 70% could call on others for emergency food, 60% had someone to call on for money, and 7% reported having no one they could call on for help with any of those things. And not surprisingly, residents over 50 were more likely to report they had no one to call on. Again, that gives us some idea of where to focus our services when working towards reducing social isolation and promoting social connection. If we move on to the final slide, this is, it's a little tricky to read at first at a glance. It might take a minute to work out, but it shows the relevance of services to residents and whether people know what services are available to them or which services are available to them. So for example, if we look at that top line, we can see that 78% of survey respondents say that mental health services are relevant to them, but only 50% of those people know where to go for those services. So if you go down the line, you can have a look at those different service types, how relevant they are in our LGA, and what proportion of those people who say they're relevant know where to go for help. So mental health, counselling, legal support, support for education, employment and training, they all have a higher than average relevance in Penrith and higher levels of awareness, which is great. When we look at women's services, food, clothing and financial assistance, they have higher than average relevance in Penrith, but lower levels of awareness. So again, this graph informs us of where to focus our efforts when promoting services, knowing how many people might be needing these services across the LGA and how many people know about them. The next slide is just a closing slide, and I really have whipped through that presentation to give people a taste of the report that's available online, and we will post in the chat the link for where people can access the report, the full report. For now, I'd like to introduce our panel of experts who can speak to some of these issues that have just come up in this presentation. We really want to hear about what they've seen with the communities that they work with and how they'll be working with those communities in coming months. So thanks to the panel for joining us today. We have Vanessa Donald-Smith, Manager of DV West Nepean. DV West is a local domestic violence service working with women and children. Thanks, Vanessa. Rebekah McLean is the Acting Operation Manager at Like Mind. Like Mind, I'm sure everybody knows, provides services for adults with mental health concerns. And I know, Rebekah, you've brought along a social worker from Like Mind as well. And I'll give you an opportunity to introduce Francesca in a minute. Rachel Scobie is the Director of Aboriginal Health at Nepean Blue Mountains Local Health District, working towards health equity and improving the health of the local Aboriginal population. Welcome, Rachel. And we have Lila from Penrith Council, Lila Kennelly, the Community Resilience Coordinator, who has added to her usual workload recently, working with communities to respond specifically to the social impacts of COVID. Thanks for coming along, Lila. So guys, jump in to respond to these questions as you can. I've got them written on paper here, so if I'm looking down, I'm just reading the questions. I wonder if who wants to jump in and talk about what have been the biggest impacts and changes for your clients and communities throughout the pandemic?
Yeah, we're very happy to jump right in. And first, I'll quickly introduce myself. So my name is Rebekah. I'm currently the Acting Operations Manager for a few of our adult mental health services under Uniting. And I've brought along with me today Francesca Fidanza, who's one of our social workers and is an intake and assessment clinician on the ground in our Like Mind Penrith office. So I might throw straight to Francesca to answer some of the changes that we've seen.
Yeah, so I definitely have seen a lot of changes throughout this time. In particular, I have noticed that it has been quite challenging to sort of do some things within the session, for example, self-soothing techniques with our consumers. I feel like that has been very challenging for our clinicians, especially when we can't really gauge, what their responses are like their facial expressions or their body language. But I guess it's been a good thing in the sense where we've had to adapt and ask more questions on the phone. For example, how are you finding this? Is it helpful? We've had to sort of adapt to that telehealth response, and I think it's been quite challenging, but at the same time it's been a good learning experience for us. So I think it's been pretty good in that sense. But also we have experienced an increase. We've noticed an increase in depression and isolation, especially those who are elderly. So the community has been quite, they've said things like they've been fearful of their health as well, especially listening to the news and things like that. So I think it'd be interesting to see moving forward, what's going to happen when they have to integrate back into society. Those have been some talks that they've expressed to us, and that's something that I hope, moving forward, we can give them that those skills to help them integrate back into society.
Thanks, Rebekah and Francesca. I wonder, Vanessa, if you could talk about some of the biggest impacts you've seen with your clients.
Good afternoon, everybody, and thank you for having me. One of the big impacts that we've noticed women have said to their caseworkers is they felt extremely stuck because the perpetrator was in lockdown with them. So they couldn't actually leave home to try and get some respite or go to a service and things like that. We also saw unbelievable added stress to women who had to homeschool. And, you know, large families have children sometimes from kindergarten right the way through high school, and just trying to get the technology to make sure that everybody had access to their online learning, but also just for women trying to stretch themselves across all of those children to make sure that they're actually doing the online learning. Just in amounts of clients, DV West in the Nepean area has supported about 575 clients since lockdown. So, you know, we've also, our referrals have come through self-referrals, so women that have contacted us through our webpage rather than going to an organisation and then getting a referral. Aboriginal clients have really suffered as well because they really like the face-to-face interaction with their caseworkers, and also women from coal backgrounds haven't been able to access interpreters as well, and different things like that. We've suffered in a way, I think, you know, staff's mental health was because they're sitting alone listening to these stories of women and not having anybody really in the office to bounce off. So I think that's taken an impact as well. But also, and Nepean's a communal refuge. So due to social distancing, we could never be at full capacity. So we've turned a lot of women and children away who needed refuge accommodation.
Thanks, Vanessa. That's a really important point. There's a real, the line seems to be blurred between the impact on clients and impacts on organisations. And we can't talk about the impacts on the clients and the communities without talking about the impacts on the organisations themselves as well, and how they've been able to run. Just a reminder to everyone that they can feel free to ask questions in the chat or raise your hand. Rachel, what have been the biggest challenges in your work and with your team in delivering services during the pandemic?
I think the biggest challenge is that everything changed so quickly, and our ability to change and adapt so quickly was required. We saw that our community's ability to connect with their family and the community, and also country as well, was really restricted. And there was, you know, there were no things like our kids' sport or our outings that we might have normally had, meant that often large families were in the home together and for long periods of time, and that can be really challenging for some. We missed out on things like our NAIDOC celebrations or our ability to attend some of our sorry business. You know, unfortunately for those people that had loved ones that passed during the COVID pandemics. It was also, if your loved one was sick and they were in hospital and you weren't able to connect with them, and it made that our usual ways of supporting our community or our mob had to change. We saw some services deliver some cultural activities online, and we really liked that. We really encouraged that sort of promotion of culture in that way. We used the post a lot more. We mailed out lots of activities and art kits for kids in the post to kind of keep people connected as best as we could. We've made lots of phone calls in our service that we wouldn't have normally done. They would have been meetings face to face, particularly to our elders and our partners, and just ensuring that they still had someone to talk to, you know, often isolated or vulnerable people. We also found that we had challenges with following government rules for such a long period of time, like many others, feeling that potentially our rights and our freedoms had been removed, and this called for a need for us to ensure as part of health, because I do sit in both worlds, to ensure that the reasons for those rules were really followed up with really adequate and clear and understood communications. And so for us, we found our storytelling really helped us in this space, being able to share those stories on social media of those that had got COVID and what that meant for them, and really the importance of, obviously going out and getting vaccinated, but also how to stay safe and how to connect with each other, and just sharing that with each other in different ways. It did identify for us the financial and the technical challenges that our community faced. Simply getting shopping, might have required a delivery service, which is a cost, or a wait. So you really needed to be planned about what you wanted to do in the future. What are we eating in 3 days' time doesn't often come up in many people's mind. For those that were relying on services and support services, they had to find a better or a safer way to interact with those services. So like Vanessa mentioned, online telehealth isn't for everybody, but it's what we had, and it's all we had available. And it's making sure that moving forward, I hope that people really can engage back into the way that we were and feel safe to be able to do that. People have learned how to QR code sign in, and we've learned how to download apps, like our Service New South Wales. We've learned how to join classes, and I think that's all challenging, but also really positive steps of how we've been able to adapt and adjust in these times, and that will help us moving forward. I feel like that it may have widened the gap for some of those that haven't, that don't have that access. And that's probably a challenge for us as services, to think about who we can help in that space in the future, thinking about, how can we change the way that we do something if something like, if we get a lockdown again, or a challenge that comes across people. We can't take technology for granted. I'm also noting that people have a fear about returning to our normal. And as you said, Melissa, we've started a different way of interacting. We're making lots of calls, and they can be, rather than large groups of people, they're one-on-one conversations that take a little while to engage and connect. But what we are finding is people have that fear of returning to normal. It seemed strange at first until I came into work and was confronted with so many people just greeting me. And it excited me, but it also scared me at the same time. I haven't seen this many people face to face for such a long time. I'm, like I said, being a representative for health as well, I really hope that we can look at how we can make people feel safe in this space in the future, and how we can still gather and still connect like our communities and our mob need in a safe and respectful way again soon.
Thanks, Rachel. You've touched on challenges for the community, challenges for the organisation, and also the things that have been working to support people and how we can build on that.
Yeah,
which is great. Lila, would you like to talk about what you've seen in the communities that you work with, and how we've had to alter delivering services to respond to that in council world?
Thank you, Mel. And I mean, really, I wanted to firstly start by saying an enormous thank you for all the incredible work that many services, voluntary groups and individuals have been doing across our city to support vulnerable people, to support people that just need an extra hand, that probably never imagined they would need an extra hand. And so it's been tough, it's been pivoting, it's been rethinking how to do things. So really firstly want to start there by thanking our amazing community sector for all the really hard work that's happened. It's been a really interesting space to be involved at the council level and look across the different organisations and what different services we're offering to the community, and also to get feedback directly through our surveys and through anecdotal feedback as well from service partners too, about some of the key challenges facing residents, many of which have already been touched on. I think what we saw was that this particular lockdown really exacerbated existing vulnerabilities, so things we already knew about, but kind of made everything worse. And so particularly for families, that there were multiple layers of challenges, I'd say, where things around digital access, we were getting a lot of feedback that, you know, it's all well and good to have school online, but then are families resourced? Are they resourced to be able to do that with their kids? And also, do they have the time, the skills, the technology access, and all of the above to kind of do that well? And a really significant issue that council identified pretty early on through this surveying process, through feedback and our work with the sector, was around food insecurity. For me, food insecurity is just kind of like, if someone really needs food and the support to eat a meal, there's a whole lot of other challenges facing that person. And through lockdown, what we saw was, so one, there's the financial pressure for, you know, either families that had recently lost work and never really anticipated that they would need support with food, or families that are kind of more long-term disadvantaged that continuously struggle with these things. If it was financial or other, the other really significant thing was people losing their support system. So where they might have a family member or a friend or whoever it may be, helping them out on a kind of more informal basis, which we know happens a lot in our communities. That's where I think that existing vulnerability really kind of came up. So, I mean, in terms of council's approach, one of the key things we did was look at the availability of food relief, emergency food relief. Penrith area is one of the biggest recipients of emergency food supplies from Food Bank, and so there is quite a large, what would you call it, plentiful supply in Penrith. But what we learned through this last few months was a lot of those services, and it's not all of them, but a lot of those emergency relief services were more focused in the Penrith city centre area. When we did that mapping and looked across the city, there was a bit of a gap around the areas of concern, the 12 areas, particularly the St Mary's area, around access. So one of the early things council did was to set up an emergency hamper hub to fill one of those gaps that we could see, in partnership with a number of different organisations, including the wonderful Westcare, Community Junction, Food Bank, of course, and the voluntary group Turbans for Australia. So it's just a very small example, but through the delivery of those packages, the other feedback from our staff who were face-to-face putting those in boots was just the enormous gratitude of residents for that support, and also the opportunity to see people, because for some of those residents, they hadn't seen anyone face-to-face for maybe 2 or 3 months by the stage they'd come up to the hub. And so all of those pressures, they only exacerbate existing mental health challenges for our community. Again, it's just exacerbating the things that are already hard. And so I guess in terms of where we want to go from here is to continue getting feedback around the emerging needs and to continuously find the best ways to address those. And one really helpful thing that that's come through this time has been meeting really regularly, particularly with our multicultural community, where there was a lot of key challenges around the changing restrictions and changing rules, and how that was communicated to people who don't have English as a first language. I mean, I found it personally very confusing to stay on top of. And so, and I, more or less read and write English pretty decently, but I think that was a really significant challenge. So getting really practical feedback from our multicultural leaders and services and multi-faith leaders was really useful, because it helped council understand where some of the key issues were that we could respond to quite quickly and how we could communicate. So a really practical example of that was sending out information in language to, I think it's close to 40,000 households, and trying to provide printed materials, because so much information was available only online, and still is only available really online. So there's plenty of work to be done as we slowly begin to recover. But again, just wanted to thank everyone here and everybody who's hopefully listening for the amazing work to support people.
Thanks, Lila. Everybody seems to have touched on, we touched on the presentation, social isolation, people not being able to rely on their usual support networks through the lockdown. And we've got a couple of questions that have come in from the participants today. people are wondering, what are some of the ways that organisations are adapting to increase social connection into the future? And how do you see organisations, industry and community working better to connect services and communicate better? Rebekah and Francesca, I don't know if you want to address social isolation and how we'll work in the future towards improving social connection and communication.
Definitely. So I think first it's probably really important to acknowledge the fact that the real and perceived social isolation was very a big part of what's been happening for us during lockdown. We weren't just thinking that we were socially isolated, we were physically separated and unable to connect in with our loved ones, which was therefore even harder if you didn't have access to technology, to use Zoom, to use the phone, that you were in fact really isolated in a way that we've perhaps never had before across our services. So something that we're doing at a very local level within LikeMind is we've got a group program coordinator, and they're developing a suite of online groups. So one of those is just a social connectedness group where people will be able to come in just to connect in with others. And we see that moving to an in-person group when our physical distancing requirements lift to be able to do that. We also have started to develop another group that is really focused on those transition stages as we come out of lockdown. So something that we're seeing is that not only were people really socially isolated, that now that we're starting to open up, they're feeling a bit anxious about that process as well. So we've gone from not being able to connect with people to now being able to connect a little bit more, but feeling really quite concerned about that. So we're exploring the ways in which we can target that to different communities, to different populations, and to have a few options available. We're also really lucky at LikeMind to have Billy, who's our community development coordinator, and Billy's looking at a variety of ways to connect in. So an example of that would be the Penrith Men's Walk and Talk. Obviously was a walk and talk throughout COVID, went to a virtual delivery, and now that things are open back up, has the option to do either or both, I suppose, to have some online and some in person. So I think for us is exploring the ways that we can have different options available to people so that they can engage in their preferred method, but also have different ways of coming together with people, whether that's sort of online chat forums, exploring that, and just having different opportunities for people to connect in. The other part of that would be opportunities like this, where we can connect services to one another, to be able to come together to talk about what's working, what's not working. We have a consortium of services working together to deliver the services at LikeMind. So really coming together to say, what are the challenges that we're facing as services and as a community right now? What are the barriers for us being able to deliver services, for people accessing services, and where are the opportunities for us to work in synergy to be able to deliver better services that are able to meet the needs of people coming to see us? So something that we've been traditionally really proud of within LikeMind is delivering a one-stop shop, so people can come into one service hub and access many services. This is a little bit similar to what's happening at the moment with the Head to Health pop-ups as well, where people can come into or call a centralised number first to be able to connect in, or come into a hub where then you can be warmly connected in with services to meet your specific support needs. And I really think that that is a great way of services progressing in the future, so that it's not left up to people to navigate. And I think your statistic was really quite clear earlier in the evidence there that most people actually really don't know how to navigate services. So even if you're feeling more disconnected than ever, you're feeling really isolated and you're trying to find support, how do you do that when you don't know what supports are out there and how to get them? So for us, that's something that we're really passionate about, and we feel is really important for the community. Is if you've only got to come to one spot, then we can support you to go to 10 other places, or to find out where they are and to work with you to say what is the best service. There might be 10 services delivering similar things. Which one might be the best fit for you? And here are the options available to you.
I think you're spot on there. I think it is very hard, like especially to sort of navigate when you have been isolated for so long. Sometimes you actually forget that you've been in isolation, and it's just very hard. And I think it's a really nice thing. It's very warm to be with a clinician, for example, to walk you through, not literally for us, but we're sort of actually giving directions and saying, and we're just giving different pathways. And I think that's a lot better than just saying, oh, I know a service that's located over here. You're really just giving them a really nice overview of what that service can provide for them, and just tailoring to their individual needs, I think, is really important.
Thanks, guys. So it sounds like you're making it easier for people to access services with that one-stop shop, and also having available different options. So online for people who are able to and would prefer that, and then the face-to-face for people who would prefer that as well, and also that individualized support, which I think, Rachel, you talked about as well with clients, having that conversation, which sometimes takes a little longer than usual because it's not a broadcast for everybody, but working with individuals.
I think that's definitely something, Melissa, that we learned during COVID, is that support, that one-on-one tailored support for individuals. We supported a lot of our COVID positive or COVID close contact cases where people were asked to stay by public health indoors as part of a public health order, other than just our normal lockdown procedures, so couldn't go out to the shops. And how did they manage and navigate that? And that really required that tailored one-on-one support with those families to ensure that they got what they needed in the timely manner as well. And that's developed into our psychosocial support team. So that is something that's ongoing for us in our community, that's available for those that do become either COVID positive themselves or a close contact to people in the community. Yeah.
Great. Lila, I wonder if you could flag some of the work that we're working towards around reducing social isolation and helping people to connect with others.
Thank you, Mel, and great question. Yes, there's, I think, probably similar to everyone, council's been in the same boat as our preference for a very long time, particularly in working in our more disadvantaged areas of the city, has been to run face-to-face activities or engagements or events or activations. And so, as like everybody else, have been impacted in our ability to do that. So, I mean, in a really practical level, in the coming months, we're looking how we can return things as quickly and as safely as possible for the community to reconnect and to celebrate that we've kind of come through a really difficult period. We're also looking at the role of public art in this time and how that can support people to feel proud of the efforts that everyone has made to get to this point as well, and looking at how we kind of connect through different means that, you know, beyond the face-to-face. We've been exploring some of the issues and concerns around digital equity access and some, you know, ways of potentially addressing that. And unfortunately, that is quite a challenging area, and that we're still looking at the best, you know, best approaches to how that how people can be supported in that space. And kind of working very collaboratively with services that do have that as part of their remit. And yeah, looking at, so returning programming, we've had a lot of contact with local schools. So a lot of, you know, in the early days of lockdown, principals had contacted council and members of my team with serious concerns around vulnerable families. So finding ways to make sure schools are resourced adequately in the coming months and years, because there actually is plenty of support available. It's often just knowing how to access it, where to turn to, how to get things set up. So on a really practical is that area of work. And I think also looking at how we can utilise the time we do have with community in the coming months and years around setting them up around with this stuff. So how do we kind of ensure that people aren't, you know, completely left on their own and really isolated due to whatever the challenge or barrier that they face. And I think it's a really good learning opportunity. So I think it's a really good time to kind of say, how would we do it next time for everyone if we had to go through it again? So I hope that kind of helps to semi-address that.
Thanks, Lila. And you've also addressed some of the questions that are coming up in the Q&A around support around IT and talking about what a challenge that is, and also supporting in terms of return to school and young people as well. I know that social isolation isn't the only impact, but I really wanted to ask Vanessa around, particularly with your clients, how social isolation has affected the women and families that you work with, and how you've managed that as an organisation.
Well, I think, you know, one of the things that adds is that the social isolation is the perpetrators in the home the whole time. There's also was much more access to alcohol. You know, they could leave the home to go and purchase alcohol or have it delivered. We saw, you know, the isolation, you know, many women reported the intensity of the domestic violence exacerbated by strangulation, which he may never have strangled, or they may have never been strangled before, and sexual assaults. There was, you know, a massive increase in that. How we've managed the isolation is it has been very difficult for staff to have eyes on children. Because previous we've run similar to what Rachel was saying, we have school holiday programs, we do outings with children, we do childcare, we run groups. So those sort of things weren't able to happen. And, you know, we open up to run online groups, but very difficult when children are in earshot. And also to do casework with women when children are in earshot, because you really don't want the children hearing the whole kit and caboodle as such. So, you know, we have done some online groups, a little bit of socialisation groups, so they could sort of just chat in with other women if they are alone and that's not an issue for them. We've had to organise sort of things like Uber vouchers, so women could get, you know, to be vaccinated or to be able to travel because they didn't want to go on public transport because of that fear of you know, the COVID at the time, so that sort of thing, but also assisting clients that maybe couldn't leave the home. They've got, you know, 5 children or something like that, and getting food delivered to them as well, so they don't have to go to the shops and take all the children with them. That's some of the ways that we've been able to manage that. You know, trying to hook women up with Zoom or FaceTime, just ways that we can just see them. And I think, like Rebekah said before, you don't catch on to those body language cues the same as you do if it's face to face. But, you know, I think staff have adapted really well to managing that. We've seen, you know, the perpetrators use the public health orders to continue harassing women, like police turning up on their doors saying, oh, we've had a report that you've got visitors that shouldn't be in your home, or we've got a report that you had a party last night. And also we saw men, well, fathers who wouldn't return children because they're in a high area and said, well, no, they've got to stay with me now. So withholding children from women, which has been, and difficult to access the courts because a lot of things were adjourned and adjourned and adjourned. So, you know, I think we've all learnt different ways. I never in my time thought that you could actually do casework remotely, but we can, and it's worked, and we, you know, we're evolving to manage, I think, whatever comes up in the future.
Thanks, Vanessa. Again, it sounds like the work has become more intensive with each individual, and that you've had to work harder to support clients. Lila, I know that you have to go to a meeting with the Mayor in a minute, and I was just going to do a quick whip around for people to provide one key learning from working through the pandemic that will support work going forward. So Lila, I'll throw to you first.
Thank you. And thank you to my fellow panelists. It is really amazing to have an opportunity. So I think there's a couple of things. One is we don't need to do things the same way, and that this has shown us that it's probably best we don't, because we need to continue innovating and trying new approaches and trying to find ways to best meet the needs of community, and we need to continue adapting that because the needs of the community, as we've seen, change very rapidly, particularly in this lockdown context. So one is kind of not doing things the same. The other one is that, you know, we're here to support each other, and just to kind of reiterate that if any service or resident would like to reach out to council, we're always really welcome your feedback and understanding of what challenges you're going through, and how we might be able to collaborate and support in the future too. So yeah, thank you everyone. I do have to duck out, I'm sorry.
Thanks, Lila. Thanks so much for your time. Rachel, I might throw to you. What have you learned through working through the pandemic that will support your work going forward?
I think we've been able to strengthen some of our partnerships that we've had and form some newer ones, or strengthen some newer ones along the way. That COVID has allowed us to do that in a different way. The other thing that COVID's allowed is it's given us the time to let us prioritize what we find as people, so as individuals, what's really important to us in our life. And so, you know, it has allowed us to see that there's a work-life balance. Things still happen while people worked from home, and for us in our office space, it's allowed us to be able to have people working from home, and that actually you don't need to be here on site to be able to do that, that you can be out there in the community and still be able to be productive and effective and working well for the community in that sense. And I think that's really personally what I've gained from it. If we have to have a positive, that's some of the positives that's really come through, is that importance of what we value. And for us and for me, that's that connection to my family and being able to really embrace that and put it up there over many of the other things that I found I was doing that I really didn't have to do or needed to do, and how I prioritize in the future moving forward. Yeah.
Thanks, Rachel. That was a really good response that covered not only you know, what the organisation has learned, but what you've learned, because obviously organisations are made up of these people who've also been impacted by COVID. We are running out of time, and for the participants who have to leave, this will be on YouTube if you want to go back and catch the rest of this, but I'll just quickly get these responses from Vanessa and Rebekah as well. Vanessa, what's been a key learning for you working through the pandemic?
I think a key learning is there's always a way that we can reach clients and they can reach us. You know, as I said before, I didn't think that casework could be done other than face-to-face, but we've learned that it can, and we've learned that we can support women remotely. We can do applications for them. We can do support letters for them. We can be there as emotionally for them. And, you know, I think one of the key learnings is there's always a way.
Thanks. Yeah, as all businesses and organisations have learned as well, that agility and adaptability. Rebekah and Francesca.
Yeah, I was just going to say, I think it's a good opportunity for us to embrace vulnerability as well, especially as healthcare workers. I think it has been really refreshing to actually open up and talk about, you know, how it's been difficult for us, which sort of, you know, it normalizes how they're feeling. And I think it's just been a really nice space for us to do that, and for them to feel comfortable expressing how they're feeling during these down times. So yeah, I just think it's been a nice opportunity for us to embrace vulnerability. I think we should do that more often. Yeah.
And similar, I think a key learning through this time has been around, for us, is leading with compassion, but working with compassion as well, not just for myself as a leader, for our teams that we work with, but for ourselves as well, is that work-life balance that Rachel spoke so highly of as well. I think COVID has really given us an opportunity to reflect on where our key priorities lie, and that's for ourselves as individuals, ourselves as workers within an organisation, and see where is the wiggle room for things that we need to be creative, and it's okay to be creative, and where are those things that perhaps seemed like really important things, but maybe weren't the things that were making huge change and moving the needle for us. And just remembering that everyone has their own unique story. We all come with our own concerns, our own challenges, and our own life stories. And I think for us is just being in that compassionate place to say, well, where can we be flexible in this recovery effort, and what are the key flexibilities and changes that we want to bring forward with us as our new normal, in a new place of being a little bit more compassionate, a little bit more flexible, and maybe a little bit more present in the choices that we make.
Thanks, everyone. Obviously, COVID has had huge negative impacts on everybody, and we've talked about some really significant issues today, but it's been great to finish off on a really positive note and and to hear from these local experts who are supporting the Penrith community. It's good to know that they're in good hands, and I'm really looking forward to working in partnership with your organisations and others as we move forward. Thanks for your time, and thanks to all the participants who have come along. Thanks again to Western Sydney Community Forum, and we'll leave everyone to get onto their next Zoom meetings. Thanks everyone. See you later.